Welcome to the third in our series of Facebook Live workshops coming to you from the Right at Home studios. Today's workshop is entitled Know Your Medicare. The workshop today is hosted by Right at Home and askjaynie.com, featuring our guest speaker Lyle Cunningham, owner of Cunningham Insurance Services. Now here is askjaynie.com's Jaynie Guarnieri-Dame.
Thank you, Dan and Lindsay, for inviting us here today, and thanks everybody for joining us. Hopefully, by the end of this series, you will have more information on Medicare and your Medicare rights. For those of you who don't know me, my name is Jaynie Guarnieri-Dame, and I own askjaynie.com and Moonlight Geriatric Care Management. I've been in the business for over 20 years, and I find all the information I can for anybody, and that's why people call and ask Jaynie. If I don't have the information, I'll get it for you. I'm here today with my guest speaker, Lyle Cunningham. He will be answering questions about Medicare for me. I have a list of questions to ask him, and he's a wealth of information. So without further ado, I'm going to introduce Lyle.
Thanks, Jaynie. So like Jaynie said, my name is Lyle Cunningham, and I've been in the insurance business for 12 years. I specialize in Medicare for seniors, and I also work with people wanting long-term care as well as other life insurance and income planning insurance products. And personally, I believe a person is as valuable as he can serve others, and so I use that philosophy in my business helping people with insurance.
I've worked with Lyle for the whole time, practically 10, 11 years now, and I can tell you he's a wealth of information. And he's my go-to guy for all of my Medicare questions. So, Lyle, I have some questions for you. Are you ready?
Absolutely. Let's begin.
We are here today to talk about the basics of Medicare. And my first question is, what is Medicare and how is it funded?
Okay. Well, Medicare is a federally funded health insurance program for people over 65 and other eligible individuals. It started in 1965, and it had originally two parts, Parts A and Part B. But it's now grown to include 4 parts, and we'll get into that a little bit later. Part C in 1985 and Part D in 2006. Most people pay for Part A while they're working through Medicare taxes and over time with the deductions taken from their wages. And then when they become eligible, they pay for Part B.
Okay, so you become eligible. Who would qualify for Medicare?
Well, someone who's a U.S. citizen or any legal resident who's lived in the country for 5 consecutive years just prior to applying for Medicare.
Are there any work-related qualifiers for Medicare?
Yes. In order to get a Medicare without having to pay a Part A premium, you have to have had worked at least 40 quarters or 10 years.
Okay, so what if I was a stay-at-home housewife and I never worked? Would I qualify?
Well, if you're married and your spouse worked, then you would be able to qualify based on your spouse's work history and payments into the system.
Oh, okay. So are there any age constraints on Medicare?
Well, primarily most people get Medicare, become eligible when they're 65. However, Medicare is also available to people with certain disabilities under the age of 65, and also for those people who've been diagnosed with ALS or who have end-stage renal disease and are on dialysis.
Is there a certain time period in which you have to apply for Medicare?
Yes, there is. In most cases, there's a 7-month window of time beginning 3 months before you turn 65. It includes the month that you turn 65, and then 3 months after that. That's called the initial enrollment period.
And if I don't sign up during that time period, am I out of luck?
Well, no, not really. There's other situations where you can enroll, but sometimes there's penalties that are involved, so it'd be good to know those things.
All right, that sounds very interesting. I hope that a lot of you already knew this, but hopefully if you didn't know it, you will have it now. So let's go back. You mentioned Part A and Part B. What do they cover? What does Part A cover? What does Part B cover?
Okay. Well, Part A is referred to as hospital insurance, and that's because it covers hospital stays, inpatient hospital stays. And basically it covers the room, the meals, the general nursing, and use of hospital facilities while you're in the hospital.
Wow, that sounds ominous. Can you expand on that for us?
Well, it doesn't include, let's say, for example, you're in there for a surgery. Part A would cover the stay in the hospital and the use of the surgical suite and any general nursing and any medications that you received as part of, for the reason that you were there. However, Part A would not cover the medical costs. In other words, the doctor or the surgeon's bills. Those come under Part B of Medicare. Part B also covers other things like doctor visits, specialist visits, occupational therapy, physical therapy, lab tests, emergency room visits. There's actually quite a few services that are covered under Part B of Medicare. But the problem with Medicare is that it helps cover the costs of these services. And the key word is helps. It doesn't cover them 100%.
Okay, so can you put that into perspective for us? Can you explain when you say it doesn't cover everything? Give us an example.
Okay. So first of all, there are deductibles for Part A and there's a deductible for Part B. And if you don't know, a deductible is what you have to pay before the insurance will pay. So in the case of Medicare, the Part A deductible is $1,340. So if you go into the hospital and you're going to be there overnight, a day or two or more, you're going to have to pay $1,340 before Medicare would cover any more of the hospital stay. In addition to that, there's a $183 deductible for Part B, and that's an annual deductible. So once you've paid that first $183 for medical expenses, after that, you will only have to pay an additional 20% of the medical bill. So you've got the deductible for Part A of $1,340, the deductible for Part B of $183, and then you also pay 20% of any medical costs. So those are the one thing that's important to understand about the Part A deductible is it's not an annual deductible. That means it can reoccur. So if you were in the hospital for one condition, you got out of the hospital and you were out for 60 consecutive days and then went back in, you would have to repay another $1,340.
So could you give us like an example, like as far as if I went in the hospital, say I went in the hospital and I had to have open heart surgery and it cost me $100,000. What would my cost be out of that on traditional Medicare?
Okay, so if all you have is Medicare A and B, and you go into the hospital, like Janie said, for an open heart surgery, you would have to pay the $1,340 deductible. And then let's say the surgeon's bill was, to make it simple, let's say $80,183, okay? And so if you hadn't met your deductible, you'd have to pay the first $183 of that. And then Medicare is going to pay 80% of that $80,000 bill. So that means you would have to pay 20%, which 20% of $80,000 is $16,000. So if you add those three numbers up, the $16,000, the $1,340 plus the $183, that would give you a good idea of what you'd have to come out of your pocket with.
Oh my gosh, that's a lot of money. I'm sure we're going to have a lot of questions about that one. And we're going to take questions afterwards. About 10 years ago, you were mentioning Part D, and I understand that it happened about 10 years ago that Congress, I guess it is, brought in Part D. Can you explain what Part D is?
Sure. So in 2006, Congress did institute Part D of Medicare. It's easy to remember that Part D covers drugs, D for drugs. And basically the way it works is this. When you become eligible for Medicare, say at age 65 or younger, you also become eligible for a prescription drug plan. And you do not have to purchase a prescription drug plan. However, if down the road you decide you should have prescription coverage because now your health has changed and you need to take prescriptions, Medicare is going to penalize you for every month that you didn't have coverage when you could have.
Whoa.
Yes.
Okay.
And let me just say one other thing.
Okay.
That penalty never goes away. It remains with you for as long as you are on Medicare.
So, Lyle, wow, that's a lot. How would I, or any one of us, protect ourselves against those additional costs? I mean, that's a lot of money. What options do we have?
Well, I'll answer that.
Okay.
You know, one of the great things about our country is there's choices, and certainly when it comes to Medicare, you have choices as to how you protect yourself from these unexpected costs. When Medicare came out in 1965, insurance companies began offering something called a Medicare supplement. And what it is, it's a separate policy that's offered by a private company that you pay for with a monthly premium, and that policy will cover those costs, the deductibles, it'll cover the 20%, and so it protects you from those unexpected costs that can arise. The other thing that's great about a supplement is there's no restrictions on which doctor or which facility you go to receive your health care. So if you need to go to the Cleveland Clinic or the Mayo Clinic, or there's a specialist across town or in another city, your supplement will cover those costs. If you're out of the country, the supplement can cover the costs. So it's a great solution. In 1985, Congress enacted another option for people called Medicare Advantage. And the Medicare Advantage plans are HMO and PPO plans that are offered by various locales. They're not the same in every part of our country or our state or even our local area. There's different plans available. And they follow the rules of any HMO. These are offered by private companies that have a contract with Medicare. And so like any HMO, they have a contracted medical group that you have to receive all your medical services from in order for your insurance plan to pay.
Like a network.
Exactly, it's
Okay.
a medical network.
Okay.
If you go out of the network, then you're going to end up paying out of your pocket for those services.
Oh my gosh.
Right. Now, PPO is a little bit different because you even though they do have a network, you also have benefits if you go out of the network. The only thing is you're going to pay more if
Okay,
you go out of the network.
so you just kind of segued into my next question, because this is so overwhelming to me, and I'm sure the rest of us. Can you explain the differences between PPOs and HMOs? We'll leave the supplements out for
Okay.
now. And also, what does PPO and what does HMO mean?
Okay, good.
Okay.
So an HMO stands for Health Maintenance Organization.
Okay.
And what it is, it's a third party. So imagine a stoplight. You know, we have 3 lights and a traffic light.
Mm-hmm.
The HMO is in the middle. The light on the top would represent a medical group,
Okay.
whether it's like Sutter Independent Physicians or Hill Physicians in our
Okay.
area. So what happens is the HMO signs a contract with that medical group for them to provide all the medical services to the members. That's the third group down below. So what happens is the HMO enrolls people, so they have members. Those members sign a contract to be insured with this HMO, and part of the agreement is that they're going to get all their medical coverage from that medical group.
Oh, okay. So the stoplight. The middle one contracts with the top one,
Right?
and then the people on the bottom, they are the users. And so
That's right.
that HMO ties them all together.
That's right.
Okay.
They're the middleman.
Okay.
Okay?
So what about a PPO, and what does that mean?
Okay. Well, let me just finish. There's a couple other things I wanted to point out.
Excuse me.
That's right. So the HMO also requires that all members pick a primary care provider.
Okay.
So out of that group of doctors that are contracted, they have to pick a provider who's going to be their primary care physician.
Okay.
And then if they need to go to a specialist, they have to get a referral from the primary care doctor.
Oh, okay. I get it. All right.
Okay.
So.
And that specialist also needs to be in the same medical group.
Oh.
They can't go to a specialist outside of the medical group.
Okay.
Right?
Okay.
And in exchange for that, now they're going to pay a premium to, or maybe not, a low premium or no premium, depending on the plan. And then they're also going to pay co-pays for the various services that they receive, doctor visits, hospital stays, etc.
Okay.
Okay? Now the difference between an HMO and a PPO is this. A PPO stands for Preferred Provider Organization.
Okay.
So where we had the group at the top that's contracted with the PPO, that would be their preferred provider group.
Okay.
And so the members with a PPO usually would pick a doctor in that preferred group, but they don't have to. They could pick a doctor outside of the group. But the difference is the copay that they would pay for seeing a doctor in the group is going to be less than seeing a doctor outside of the group.
Okay. So they give you a network of doctors that you can use that are going to be a lesser amount for a deductible or for a copay.
For copay, that's right.
Okay, for a copay. So if you decide that you want to see Dr. Brown and he's not in that network, they will pay for part of it, but you might pay more
Exactly.
for that deductible, or not deductible, a copay.
Right.
Okay.
So examples, maybe it's a $20 copay to see an in-network doctor.
Okay.
That same visit to a doctor outside of the network might be $40.
Oh, okay.
Okay.
All right. Well, there's a benefit to that.
Absolutely.
Do either of these programs, an HMO or a PPO, do they follow you across the country? I mean, can you be on vacation somewhere and use them outside of the state or the county that you're in?
Good question. Typically, they don't follow you like a supplement would, but they do cover you in case of emergencies.
Okay.
Okay. So I'll give you an example. I had a client who had a HMO plan here in Sacramento.
Uh-huh.
Was out of the area in New York. Hurt himself, had to get stitches. So his HMO plan covered that. But when he went back to get the stitches removed, that was no longer an emergency, so the plan didn't cover. He had to pay out of his pocket.
Got it. Okay.
Had he had a supplement, then that would have paid.
Okay, so I'm glad that you said that because that's my next question again. What is a supplement as opposed to? My knowledge of supplements is that they are called Medigap policies and they're sold by private insurance companies and that there's usually a premium monthly for them.
That's correct.
Okay, so I know enough to be dangerous. Fill us in.
All right. Well, that's true. So a supplement, like I mentioned earlier, is a contract. It's a policy that you purchase, and it will pay. It'll cover those costs that Medicare doesn't cover, those deductibles.
Okay.
One of the great things is, like I mentioned earlier, is you're not limited to a network like you are with an HMO or PPO.
Okay.
It also allows you to, it travels with you. So like I mentioned, this client, had he had a supplement, he wouldn't have had any costs for the emergency room visit, nor would he have had any costs to have the stitches removed. The other thing is if you have medical conditions and you see doctors in different networks, right? When you have an HMO or PPO, all your providers have to be in the same network. And if you have a medical history where you've been taken well care of and these doctors know you and they know what you've been through, a lot of people don't want to have to give up those doctors. So having a supplement gives you a tremendous amount of flexibility with regard to that.
Okay.
But they do cost more. So you're going to always have a premium with a Medicare supplement. And for a person 65, you're looking at about $150 a month.
Okay.
And it goes up as you age. So
okay, so I have kind of a multi-question. If you choose an HMO or a PPO, do they include the D portion, or do you have to purchase a D program on top of that?
Okay, let me answer that this way.
Okay.
The HMO plans and the PPOs, the Medicare Advantage, combine A, B, and D into one plan.
Okay.
So your prescription benefits are typically part of the HMO or a Medicare Advantage.
Okay.
In rare cases, it doesn't include Part D, but in our area, they're all covered. Okay, they're all included. With a supplement, prior to 2006, there were some Medicare supplements that did include prescription benefits, but when the rule changed that created Part D, insurance companies were no longer allowed to offer supplements that included prescription coverage. So that meant that when people sign up for Medicare and purchase a supplement, they should also get a separate standalone prescription drug plan, sometimes referred to as a PDP, prescription drug plan.
Okay, so just for all of us, if, say, I chose when I turn 65, which isn't for another 30 years, if I chose a supplemental program, they take $134 a month out of a Social Security check to pay for Medicare, correct?
Yes.
Okay. And then I would have a monthly premium for the policy that allows me to go anywhere.
Yes.
And then I would have to pay for a drug program on top of that. How much, or the plan D, how much would I pay for a Plan D policy?
Okay. Well, there's about 25 different prescription drug plans in our area for people to choose from.
Okay.
Okay. And they have different premiums. Some have a deductible, some don't. They charge different amounts of co-pays for the different medications. The least expensive plan, I believe, is under $20 a month.
Okay.
And there's plans that go up to as much as maybe over $100 a month.
Right.
Okay.
So what if I have a special medication that I'm taking and I want that and I don't want a generic? I want that drug because I've tried all the others. how would I know which plan to choose?
Well, if you have an agent, the agent can look up that information for you. If you
Okay.
don't have an agent, you can call the various companies and find out, ask them that question, ask them about the medication that you're taking,
Okay,
and you can find out. There's also a tool online,
okay,
Medicare.gov.
okay.
It allows you to enter your medications, and it'll actually calculate the costs between now and the end of the year, total out-of-pocket premium, co-pays for all your medications.
Wow.
It's a really great tool. I use it all the time
Okay.
because in many cases, the medications that a person's taking
Mm-hmm.
is their biggest healthcare expense.
Right, right.
I mean, it can be really, really a lot of money.
Okay, so I'm going to go to something, not on what I was going to ask you, but something that came up at another meeting that I was attending. What about the donut hole? What exactly is a donut hole, and who does that affect?
All right. Well, when Medicare created, or when the Congress created Medicare Part D,
Mhm.
they created this structure that there's different stages or phases of the prescription drug plan.
Okay,
There's 4 stages. The first one is the deductible stage. So say starting in January, you just signed up for Medicare and now you're starting out.
Mhm.
So you're in the deductible phase.
okay,
If your prescription plan has a deductible, then you will pay all the costs of your medications totally out of your pocket until you've met that deductible.
oh, okay,
Once you've met that deductible, then you move into the next stage, which is called the initial coverage stage.
okay,
And in this stage of the prescription drug plan, you will have a share of costs based upon the medications you take and what the plan charges for those medications.
oh, okay,
So Medicare keeps track of the total cost of your medications, what you pay plus what the plan pays.
okay,
Once your total medication costs have reached $3,750,
oh,
okay, then you move into what's called the coverage gap or the donut hole. Okay.
uh-huh,
Now let me just be clear. When I say $3,750, because you have a prescription drug plan, maybe you're only paying $200 a month, but your medications might cost $500 a month. That means the plan is paying $300, you're paying $200, so $500. So you wouldn't reach that donut hole until divide $500 into $3,750, and it'll give you an idea.
my head is spinning right now.
Probably 7 months into the year, then you would go into the donut hole. And when that happens, your share costs will go up. You'll have to pay, I think in 2018, it's 44% of the cost of brand name medications, and I think 55% of the cost of generic medications.
Wow,
And then, when your total out-of-pocket has reached $5,000, you move into what's called the catastrophic phase. That's the 4th phase of the plan. And when that happens, your costs go way down, like $3.50 or
wow.
I don't have all those numbers memorized, but they're very, very low at that point.
So in that scenario, is that the same all across the board for HMOs, PPOs, and somebody with a supplemental plan and a Plan D?
Absolutely.
Okay.
It's standard in all
Okay.
prescription drug benefits, yes.
Okay, so what are the downside? What's the downside of an Advantage or a PPO? The Advantage ones, the PPOs or the HMOs. What are the downsides?
The advantage or the downside? The biggest downside is where it can be a downside, I should say, is that you have to have a referral to see a specialist. You're not, if you, for example, let's say you had some skin rash and you tried over-the-counter things and it wasn't going away and you just wanted to go see a dermatologist.
Mm-hmm.
With an HMO, you have to go see your primary care doctor first and then get the referral.
Mm-hmm.
With a supplement, you can just call up a dermatologist, go and see him and get treated.
Oh, okay.
So that's a bit of a hassle, or it can
So
be.
you have more control over your own health care with a supplement rather than with an HMO or a PPO.
That's true.
Okay.
But you're going to pay more.
Okay.
So we kind of say this. We say, with a supplement, you pay now, but you save later.
Right.
With one of the Advantage plans, you save now because you may have a low or no premium,
Right.
but you're going to pay later on all the co-pays,
Okay.
right?
Right.
Give you an example also in terms of provider choices, right? I had a client who turned 65 in November. This is a couple years ago. Very healthy woman, never had any medical issues to speak of. She played golf, she walked. She was very healthy. And so when I went over her choices, there was a plan actually offered in Placer County, which is where she lived, that had no monthly premium. She goes, this sounds great. I only go to the doctor twice a year. I get an exam, I get a checkup, and that's it, you know.
So was that an HMO or PPO?
It was an HMO.
Okay.
So we signed her up on the HMO, and she remained on that through November and December. She stayed on the plan in January, February, March. April, I get a call from her. She's in the hospital. Well, she had this rare condition come up where she didn't know what happened, but she was going down the stairs on a Sunday morning and was paralyzed. All of a sudden, couldn't walk anymore. Her husband had to lift her up, put her in the car, drove her to the hospital. They ran all these tests.
Wow.
And they found that she had this strange, it was a very rare condition, like 1 in a million, they said. And typically with women at this age of their life is when this shows up. And a blood vessel in her spine was leaking blood into her cerebrospinal fluid. And so it was interfering with her body's ability to control her lower limbs. So they advised her that there was a surgical procedure that could be done, but they didn't want to cut through her back because she played golf and was very active. They wanted to do it intravenously. So the best person around was at the University of San Francisco, the person they recommended, the top person, right? And she was asking me about that. And I said, well, unfortunately, you know, that person's not in your network, your plan won't cover. And of course, she was really distressed about that. She remembered our conversation and understood. But fortunately, they were able to find somebody locally that did the procedure. But she says, Lyle, I never want to go through that stress again. I don't care
Right.
what it costs.
Right.
She had the money, and so we put her on the supplement.
Okay, so with that being said, my question is, in that scenario, if someone chooses a plan and they find that they are not happy with it, can they change plans?
Right, okay. I'll answer that this way. Medicare has these enrollment periods, and every year from October 15th through December 7th is what's called the open enrollment, or annual enrollment. They use two terms. And during that 7-week window, you can make changes to your prescription drug plan. You can make changes to your Medicare Advantage plan.
Okay.
Any changes you make will become effective on January 1st of the following year.
Oh,
Okay. So you can also go back to original Medicare and just, you know, cover the 20% on your own.
Got it.
So that's the time of year when you can do that. There's other times called special enrollment periods where you have a right to switch plans. For example, if you move out of the area, right? Or another thing that can happen is if you end up in the hospital and the plan you're on doesn't seem to be suiting you, when you're confined like that, you also have a right to switch.
Isn't your birthday one of those days too?
The birthday has to do with the supplements,
Okay.
not the HMOs.
Okay. So
There's different rules.
Okay, so we're back on the supplements.
Okay.
In order to get on the supplement, my understanding is that when you first sign up for Medicare, that it's you used a term. It's guaranteed enrollment. What if you're on a plan for a couple of years and you decide that you're going to travel and you want to go, you know, throughout the United States, but your plan is local and you want to change to a supplement, and so you decide, okay, I'm going to change this plan. Do they guarantee you to get into that plan, or are there hoops or something that you have to jump through?
Well, there's some rules that come into play. So
Okay.
like you said, when you first turn 65, you have choices. You can get an HMO Advantage plan. You can get a Medicare supplement and a standalone prescription plan. No questions asked. No medical questions asked. No prescription lists are required.
Even if you have like a huge medical.
You could be lined up for a heart transplant, and it wouldn't matter.
Okay.
Okay.
Good to know.
You can join.
Okay.
So let's say you chose, like my client did, the Advantage plan because no premium sounded great and you're healthy, right?
Yeah.
So let's say you're on that for a couple years and everything is great, but then your health takes a change for the worse. And so now you want to switch to a Medicare supplement. Well, you will not have that same guarantee necessarily. There's certain circumstances where you will get a guarantee, but those are limited. For example, at the end of the year, during the open enrollment period from October 15th through December 7th,
Right.
all companies are required at the beginning of October to send you out something called the annual notice of change.
Okay.
And that notification is going to itemize the changes that are proposed for the following year for the plan that you're on.
Okay.
If there's a change in the premium, it's going to show that.
Okay.
If there's a change for your costs, for doctor visits or hospital stays, whatever, they're going to show you what it is this year and what it's going to be next year.
All right.
In any case where there's an increase of 15% or more of the core benefits or the premium, you will also have a guaranteed right to switch to a Medicare supplement.
Oh, without the underwriting.
Without the underwriting,
Okay,
without the medical questions being asked.
Good.
Okay? Then so now another scenario. Let's say you have a Medicare supplement, and let's say based upon your age and where you live, you're paying $170 a month.
Okay.
And you get a notification that their rate is going to go up. And so you call your agent and you go, is there any way that I can, I just got this notice, my rate's going to go up $20 a month next year. Can I switch? Well, you can switch to another Medicare supplement and go through medical underwriting. They don't necessarily have to take you. They can reject you. It's going to save you money. But if you do that same application within 30 days of your birthday, then you have what's called a guaranteed issue. It's called the California birthday rule.
Wow. Okay. Yeah. Cool. That's great information. So we don't have to worry about the underwriting process. And what if you're in the skilled nursing facility and you're getting, you don't like the doctors and you don't like what's going on? Can you change while you're in the hospital, or do you have to wait till that open enrollment period?
That's another example where you can switch Advantage plans.
Okay.
All right. If you had a supplement, there'd be no need to because you wouldn't have any costs. You can see any doctor you want. But that comes into play when you're on the Advantage plan.
Right. Okay.
And so you do have a right to change during that period of time.
So how do we, lay people, how do we figure all this out? I mean, I've gone on that website and it's all Greek to me. And how does someone know if they're getting into the right plan?
Well, I mean, if you're not willing to do all the research yourself, which can be laborious, and it can be confusing, hopefully you have an agent and you call that agent. I mean, I let all my clients know, usually in September, to be on the lookout for that annual notice of change, to take a look at it when it arrives, and if they want to investigate other options, to call me. We'll schedule an appointment. I'll help them understand all their choices and handle the enrollment for them. I think it's important for people to know also this, and that is that, if you use an agent, you're not going to pay any more or any less, than if you went to the company directly.
So you as an agent, you can't charge the customer that's coming to purchase that, to give your wealth of information, it's incredible, to go online with them, look at all their medications. You can't charge them for that.
Not legally.
Okay.
And I don't.
Okay. Will the government call them on the phone and say, hi, I'm here to help you, pick a plan?
No, they will not.
Okay.
So if anybody calls you and they're soliciting your business, that's another thing. Medicare actually makes it illegal for agents to call and solicit business for Medicare Advantage. Not for supplements, but for Advantage. You're not supposed to be getting calls. And I know that when I turned 65, the year before, I got tons of mail, I got lots of calls. So, it can be confusing and overwhelming with all the reach for wanting your business. Sign up on this plan or that plan, and, there's rules and penalties, and what do you do? So, seek out an agent, if you don't have one. It really can save you a lot of time and hassle and prevent yourself from making mistakes.
Great. And you have information for everybody, and you have brochures and cards and everything like that for them. Okay. So, I'm going to tell you, I send all of my clients that are in need of anything to Lyle, and he's my go-to guy. I know enough to be dangerous, and then I turn him over. That's how smart I am. I will get you there. So I thought you had some questions for me. Yes or no?
Yeah. So let's take, for example, one of my clients now has an Advantage plan, or they have a supplement, they have Medicare, and they end up in the hospital.
Okay.
Tell us, because you have a wealth of knowledge on what happens on the other end.
Okay.
What happens in their life when that occurs?
Okay, so when someone I'll give you an example. Someone falls and fractures their hip. You're going to call 911, you're going to go to the hospital. A lot of people think that when they go into the hospital, especially with a broken hip, that they're going to be seen immediately. Basically, when you get brought into the emergency room with 911, if you had don't display severe heart failure, you're not having a heart attack or a massive stroke, you're going to wait in line in the emergency room. That's just going to happen. And they're going to get to you. They'll probably do an x-ray. They're going to tell you need surgery if it's the hip is fractured. And then they schedule for surgery. So when that happens, you get the surgery. If you have a 3-day overnight stay in the hospital, then you have a right to go to a rehab facility. And early in our conversation, you said we have choices. That's the great thing about choices, is that I basically want to give you some information, and I'm going to read it from my list of things. Everybody has rights. So everybody has a right to go to the hospital. As you said, Medicare, if you're out of your area, you have a right to use your emergency benefits at a hospital. But if it's just a traditional, I fractured my hip, I'm going to a skilled nursing facility, you do have rights. And part of those rights are you get to choose what facility you go to rehab in. And I'm going to use my notes here. So you get to have a right to emergency services. You get to right to choose your rehab. Even if you're with an HMO who contracts, they contract with skilled nursing facilities to provide services such as rehab. But you don't necessarily have to go to one of those. An example I had a couple weeks ago is that someone lived in Rockland and they wanted to send them to a facility in Elk Grove. Well, if you've got an 80-year-old, wife who's going there and a 90-year-old husband who has to travel back and forth, you have a right to say no and choose one that's closer. And that's the biggest thing I want everybody to know. If you go to a rehab, you have to have stayed in the hospital for 3 overnight stays. And this is key because the choices, when you get those choices, they have qualifiers. And so if you go to the hospital and they don't admit you, and you're there under general observation, and say you're there for a whole week under general observation, you don't now qualify for Medicare to pay for your stay in the skilled nursing.
Wow.
So it's really, really important to know your rights and know what the terminology is so that you are empowered to get the things that you need and have a right to. You get up to 100 qualified days. And that's the other thing. Qualified means that Medicare has a prescribed agenda for you when you're at the skilled nursing facility, and you have to progress every day for them to give you those days. You don't automatically go to the skilled nursing facility and stay there for 100 days. You have to be doing something and be progressively getting better in order for the skilled nursing facility to keep you there. I can't tell you how many times I have people say, well, what about my 100 days? I get 100 days, of skilled nursing, and they're trying to kick me out. Well, it's because you haven't met, or you already met, what they feel is your new baseline.
Well, I remember when my mother-in-law was in the hospital after a stroke, and she was going through rehab. This is over at Mercy, and I remember shortly after she was in, where they called a meeting, and we went and they were already discussing discharge. And I go, well, wait a minute, she just got in here, and I mean, aren't there rules on when, how many days she has, and so on and so forth. And I remember talking to the therapist. She goes, well, once she can walk, 100 consecutive steps or something like that, we have to discharge her because Medicare won't pay us anymore. Well, it was really strange because she could walk, but not unattended. I mean, she had to have somebody walking with her hands in front and back in case she fell because she was unstable. She still had paralysis, but, they were going to...
So a lot of people look at Medicare, and you said it earlier, Medicare as insurance, and a lot of people ask me, well, doesn't Medicare pay for somebody to help me when I go home? Medicare is for acute in the hospital, getting you to a point where you are not dying. And then rehab is a subacute hospital, and Medicare pays for that to give you the therapies, because physical therapy, occupational therapy, and speech therapy, those things are medical issues. And once they get you to a point where you can leave their facility with someone assisting you, it becomes no longer a medical issue, but an activities of daily living issue. So somebody walking beside you, you don't need a nurse, you don't need a CNA, you don't need a doctor. That's somebody helping you walk, getting in and out of a chair. That is not a medical issue. So that's why people get really confused, because they think you're going to spend 100 days and that when they leave, they're going to go back and be mowing the lawn again. And that's just not going to happen. If you don't get back to your baseline before your accident or before your medical incident happens, you then become a new baseline. So if you were here and now you're here, based on Medicare guidelines, that you can walk that 40 feet in one direction and 40 feet in the other direction with a walker or with somebody holding on to you, you now are ready to leave the hospital. And I know that's so confusing to seniors, and they just don't understand it. Family members don't understand it.
Right.
So you have a right to have a care conference when you go into a skilled nursing facility within the first 4 days. And I say 4 days because sometimes when you go to skilled nursing for rehab, you go on a weekend, and they're not going to have enough time on that weekend to look at your chart, look at what the doctor's orders are. So they might need Monday and Tuesday to set up the care plan for you. But you have a right to meet with them and find out what that care plan is, whether it's for yourself, whether it's for your spouse or a loved one. You have a right to be at the care meeting, and you have a right to get a copy of that. And then you have a right to go to all the other care meetings. You have a right to talk to physical therapy, occupational therapy, and the people who are in charge of your care while you're there. You're not to be kept in the dark. So if you know these things and you continually ask questions, then you're not surprised when they say, guess what, you're done, you're going home. Because now you've been in touch with them on a regular basis. You really, when they say she's medically stable, a lot of people don't understand that. And so if you stay in touch with them, if you know the medications, that's a key. A lot of people go in to a medical setting and they're on medications. But when they go into the hospital setting and then the skilled setting, they change the medications. Literally, I knew somebody several years ago who her father was on Parkinson's medications, and she had him on specific doses at specific times. Well, they don't do that. They don't have enough staff to go in and give them, if you're at 10 o'clock at night and 4 o'clock in the morning, they don't have time to do that. They're going to give it when it's convenient. Well, her father almost died, and she had to sit at the skilled nursing facility and make sure that her father got those doses on time. Wow. Those medicines are critical. They wanted to add other medications. You have a right to say no. They wanted to pull medications off of another client for behaviors. You have a right to say no. You are going to give those medications and make sure that they give. You have to be an advocate. You have to be an advocate, and you have a right to do that. So what happens if you feel like your loved one is not medically stable to leave? Well, you can file an appeal. That's your right. An appeal is when you don't feel that person's medically stable to leave that environment. It doesn't mean I don't have a place for them. I can't take them home. They can't live alone. You have to call Medicare and you have to tell them, I don't feel that my loved one is medically stable. What happens then is they send the chart to a third party, Medicare, and a doctor reviews it. Now, I'm going to say something that a lot of people aren't going to want to hear, but a lot of times discharge planners will bend the truth a little bit, and they will tell you, if you lose this appeal, you will have to pay for that 3-day stay. Absolutely not true. You will never pay for care received for the time you stay in that hospital or that skilled nursing while it's under appeal.
Good to
That's
know.
your right.
Wow.
You have a right to decide where you go after rehab. And honestly, whether you go home, whether you decide to stay at that facility in the convalescent side, whether you go to assisted living, whether you go to a friend's or loved one's home, or whether you go to a small residential care home, you have a right to choose where you go. That discharge staff person cannot tell you to go to one place or another. You have choices. And they cannot tell you who to work with to find those things. You can go online. You can look at the places. You can go to the California website. You can see if they're in good standing. But it's best to have somebody help you do that, because honestly, it's ominous. It's so ominous to go in there and not know what to ask and not know what to look for. So you always want to work with somebody, but you have choices. So you you ask for choices. If you have someone that you've already worked with, or a friend offers somebody that they worked with, you can tell that person, I've got somebody, I'm working with somebody else, because that's your choice. Let's see, you have the right to have ongoing therapies at home. Medicare will pay for physical therapy and occupational therapy to follow you back home to an assisted living. We talk with, when we ask for those therapies, we ask them for transitioning you back into another setting, into the community, because a lot of family members don't know how to transfer somebody, and they need training on that. Sometimes they can go to the skilled nursing facility and get it, but other times there's steps at home, or there's a different setup, a bed, not a hospital bed. So we ask for physical therapy to follow them, occupational therapy to follow them, and Medicare will pay for this, but a lot of people don't know that they can ask for it. So those are just some of your rights. If there are a lot more, we don't have time for them, so you can always call me and I can go over them with you.
I just want to interject something, because I went through this with my parents, my father, my mother-in-law, and my stepmother, and having you there was invaluable, because I could call you and you could give me what to say, or you could share with me what my rights are, or my mom's rights.
Yep.
And when you go into this, when you experience something like this with a parent, you don't have a long time to study it.
Mm-hmm.
You just have to know, and if you don't know, you get taken advantage of.
They can tell you in skilled nursing,
right.
They can say, we're discharging Friday and it's Wednesday, and you're like, what?
I know.
What do I do?
Exactly.
So that's why it's important, and I'm just going to say this, it's important to, when you're in this situation, from the hospital setting, start doing your research on geriatric care managers or people that can help you do this, and have that person follow you from the hospital to whatever skilled nursing. A lot of times if you call someone in advance and you say, we're getting discharged to a skilled nursing, I don't know which one's the best, I don't know where to go, I don't know what to do. That person, if they're well trained, they can guide you through that path into the right setting. And it's all based on Medicare guidelines, and you want to work with somebody that knows those Medicare guidelines.
Absolutely.
Because if you don't, you're like a fish out of water, and so it's very helpful to be helped along the way.
Yes.
Anything else that you have to offer about Medicare, aside from the fact that you're an expert and you'll help them?
Well, you've covered like what happens in an emergency. We've kind of touched the tip of the iceberg here with all the stuff that people really need. Mm-hmm. Just having you as a resource has really been hugely beneficial to me, and also to my clients, my family. So I feel blessed to know you.
Oh, you're such a sweetheart.
I'm serious. It's awesome. It's amazing information to have, and it's powerful. It's vital.
Just so everybody knows, if you miss anything, we're going to be doing a series on Ask Jaynie on my Ask Jaynie Facebook page, and several other areas, Instagram, and we're going to be talking about this topic for a little while. And if you have questions, feel free to call either one of us, and
Sure.
we will answer those questions for you.
Great.
I just want to thank you for coming. I know this is, a lot to ask of you because you're very busy, but I really appreciate you, what you do, how you handle all of my clients that I've sent to you, and you do it with such a gentle, loving way. And I've asked you personally several dumb questions, and he never makes me feel dumb. He always makes me feel like it's okay. So I thank you for joining us.
All right.